From the Central Western Washington area, Choice Regional Health Network presents the Equity Circle podcast, a place for information with integrity, accountability, and innovation. Enjoy the episode. All right, everyone, welcome to the Equity Circle podcast. Really excited to be here today with a guest that we've had a couple times. So Dr. Maria Huang, welcome to the podcast.
Thank you. Thanks for having me.
Of course. So for those that maybe haven't listened to previous podcasts, why don't you just tell us a little bit about yourself? How about something personally and professionally?
Sure. Well, my name is Maria Huang, and I'm a general pediatrician from Olympia, Washington. And I have been in practice for 11 years, and I'm a strong advocate in the Washington legislature for um, students' kids' physical and mental health. And personally, I'm originally from Cleveland, Ohio.
Okay, awesome. Well, thanks for telling us a little bit more about yourself. So today we wanted to have you on to talk about the booster shot specifically for kids 12 to 15. I know that's been recently approved
Right.
for kids to have that vaccine. And so I wonder if you could tell us more about it and what we know about this booster.
Sure. Yeah. So the CDC, the Center for Disease Control, recently approved the COVID Pfizer booster vaccine for ages 12 to 15. And so Pfizer is a 2-dose series, and then the booster will be 5 months after your second dose. Um, the American Academy of Pediatrics strongly supports this recommendation for boostering, and I also am in strong support of it. Um, the way boosters work and why we need them is that those first 2 doses kind of prime our immune system to create antibodies when we see the COVID virus. But unfortunately, that immunity can't last forever. And so it wanes. And so we often need booster doses that build on those first 2 vaccines so we can have longer immunity. And we do know, especially with Omicron, the variant right now, that the likelihood of getting COVID is far less if you are fully vaccinated and boosted, even more so than if you were just fully vaccinated and not boosted.
Hmm. So it sounds like this is another way to help protect some of our youth. Kind of sounds like.
Absolutely. Yeah.
Okay.
And I know we're all really tired of this. But we still do have to keep masking, keep distancing. When you're sick, stay home. But really, the best protection is getting vaccinated. And if
Yeah.
you're eligible, please get boosted.
With with this booster shot, can you talk a bit more how it's different from the regular vaccine for kids that age 12 to 15?
Sure. So, this booster dose is exactly the same as the first 2 doses of the
Okay.
Pfizer vaccine. So the first 2 doses are 30 micrograms, and the booster dose is also 30 micrograms. So essentially, it's absolutely the same vaccine and the same dose. As an aside, the Moderna booster, which is Moderna is only approved for ages 18 and up. So the Moderna first 2 doses are 100 micrograms, and their booster is half that. It's 50 micrograms. But
Okay.
since we're focusing on the 12 to 15-year-olds, it's Pfizer, and it's the exact same dose. So if parents have some hesitancy about that and their child did well for the first 2 doses, I would not be at all worried about getting boosted.
Hmm. And so, if I understand correctly, right now, this Pfizer booster shot 12 to 15 is just in emergency use authorization at this moment. Is that correct?
Correct. Yes.
Okay. And do you have an idea of when that could be moved to full approval?
I honestly don't know. I think they're more likely to look for that full approval for the 5 to 11-year-olds
Okay.
before the booster doses.
Okay. And why is that? I'm just curious.
I think it's because we want to get the FDA and the CDC want to get as many people vaccinated as possible. And so
Sure.
if we can vaccinate the 5 and up, um, that's more important right now than the booster. Although, obviously we know the booster is important.
Sure.
But what's really telling is now we see a lot of the Omicron cases in the less than 5-year-olds. So the ones
Mm,
who can't be vaccinated are really at high risk. So they definitely want to approve and authorize vaccines for everyone first before doing all the research for the boostering.
sure. Sure. No, that makes sense. Thanks for taking the time to explain that. So,
Sure.
um, I'm wondering if you could kind of touch on if there's any like concerns parents should have, if any, about the booster, and if there are any concerns, maybe how can you calm those concerns?
Sure. Yeah, I mean, like I said, the booster dose is the exact same as the first two. So if your child did get the first two, I would again not have any hesitancy about the booster. If your child has not been vaccinated, I would obviously highly encourage that. And, I think one of the things that we talked about on previous podcasts is the concern for myocarditis. And actually, there was a study that came out of Boston Children's Hospital in December that looked at 139 um, 12 to 20-year-olds that had myocarditis after the COVID vaccination. And what they saw from this research is that myocarditis after vaccination is still extremely rare. And if you do happen to get it, the symptoms are often mild and resolve quickly, as
Mm,
opposed to getting myocarditis from COVID infection. Often symptoms are quite severe and require hospitalization and are more prolonged. So, again, we know that the benefits of vaccines far outweigh the risks. And
so it's not.
especially, with Omicron right now, it is so important.
Yeah, absolutely. And so it sounds like for those that have gotten vaccinated, between that age range, the study that you referenced, sounds like it was, if there was myocarditis, it was milder and the symptoms seemed to go away quicker as opposed to maybe those that were not. Is that correct in what you were saying?
Yes, that's correct. And the myocarditis that we saw is predominantly in males, um, and it's often a week or two after their second dose. So
Okay,
if there's any concerns about myocarditis with the booster, we haven't seen any evidence of that. And so if they did well after their first 2 doses, again, I wouldn't have any hesitancy about boostering.
sure, sure. Well, Dr. Huang, it's been really um, educational, learning more about the booster shots. I know I've sometimes shared with other podcast guests that I don't have a medical background, and so I think hopefully that this is as educational for others as it always is for me, learning more about things and being able to understand the science of the vaccine and really why there is consistency in the fact that the vaccine really does work and it really is our best bet moving forward. And so I'm wondering if there's any final encouragement or things you would like to share about this booster shot or even about anything else related to what you've seen surrounding COVID in your professional opinion.
Sure. Absolutely. And I'll just add that I am thrilled to be on here. So happy to be a guest anytime. So I would just say that again, for any parents that are still concerned about the vaccine or are kind of doing the wait and see approach, now is the time to get vaccinated. So as of last week, 7 million, that 5 to 11-year-olds in the US, including my daughter, who's fully vaccinated, she's 9, and 15.7 million 12 to 17-year-olds have gotten their first dose of vaccine. So that is over 20 million US 5 to 17-year-olds. And so
Wow.
we know based on that, that from the data, it is safe and it
Yeah.
is effective. And for those 12 to 17-year-olds, we know that it decreases the risk of getting COVID by 93%. And
Mm,
for those 12 to 17-year-olds that are hospitalized, 97% of them are unvaccinated. So,
mm,
these numbers are really, really telling that we need to do this. This is your best protection. And because Omicron is so contagious, it's just really, even if you do everything right, it's still a risk.
yeah.
Um, so please try to do everything right and try to protect yourself with vaccination. Um, I'll also add that just please remember that your choice for vaccination doesn't only affect you, but also um, your family and your community. And what we know right now is that hospitals are full.
Yeah. Yeah.
The staffing is really difficult, and we're getting close in some areas of the country to crisis standards of care, which is really scary. That means that,
Yeah.
hospitals don't have rooms and there's not enough doctors and nurses. And so I think sometimes people think, well, Omicron's everywhere. I'm just going to get it and get it over with.
Yeah.
Um,
Yeah.
but I would encourage you not to do not to actively do that and to continue, all levels of protection, because if people have that mindset, you know, it's true, some cases are mild, but some are severe and require hospitalization, and our hospitals are already overwhelmed. So,
Sure.
um, yeah, just please get vaccinated, get boosted, and continue pressing on in this
Yeah.
long, long battle.
Yeah, definitely has been a long battle. But I do want to take the time to say thank you for the work that you've done during this pandemic, as well as many others who have definitely navigated these tough waters. And like I said before, it sounds like getting the vaccine is our best foot moving forward, and not taking chances trying to get COVID. Sounds like the best
Sure,
route is
right.
to is to get the
Absolutely.
vaccine and get boosted. So, Dr. Huang, thank you so much for taking the time today to be on the podcast. We really do appreciate it.
Thank you. Always happy to be here.
Well, I want to also thank our listeners for listening to another episode of the Equity Circle podcast. Please leave us a review. It helps others find the podcast. Lastly, subscribe and share with friends and family. And remember that equity equals progress. Thank you.